I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It, Episode 9. Be sure to subscribe to this podcast, and you'll never miss an episode on how to naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
We're going to talk today, fun little thing. We're going to go old school here. We're going to talk about home remedies. Things that you can do every single day to help get yourself well and keep yourself well. And then if you do have something come up, ways that maybe you could avoid spending money or going to the doctor. So hopefully you can fix a lot of things at home. I grew up in a real poor family. My father was disabled. He had an accident before I was born and broke his back and fractured his skull. He went deaf. So my dad never heard my voice, which may be good, maybe a good thing for him. But we didn't have a lot of money, so we had to fix things. And we did it all the way across the board. My father came from a big family, so sometimes there'd be, arguments among the family, and you fixed it. You didn't just leave it. You didn't leave the family, and you just made things work. And that's what I'm going to try to teach you today is things that you can do and make it work so that you don't have to run out and spend a lot of money and a lot of time and many times not get the results that you want. And the good news is if we do something, we do a home remedy and it doesn't work, well, they're relatively safe. We're not going to do things that are really risky here. So let's jump right into it. Let's start out with colds and flu and sinus problems because everybody's got allergies and colds and flu. And what do we do about that? Well, when your immune system fights off a cold and a flu, you start to feel symptoms like a scratchy throat, or achiness, fatigue, runny nose. Well, that's the body fighting off the disease. So that's a good thing. However, I don't like to suffer if I get sick, and you probably don't want to either. So first sign of getting sick, a couple of things you can do. Number one, elderberry juice, or elderberry liquid extract it's called, is pretty cool. It helps with irritation and that's going on in your body, and it can help the immune system. So this is old school stuff. This is stuff your grandmother probably used, and now it's made full circle. And it's cool because the things that are truthful will always come back in style again. I felt that way as a chiropractor, of course, 33 years ago when I went into practice. We were the quacks. We were the voodoo doctors. We were the witch doctors. Chiropractors aren't real doctors. And I remember thinking, wait a minute, I went to school 300 hours more than my medical colleagues in most cases. I understand health. I understand that, yes, sometimes you need drugs, sometimes you need surgery, but many times things can be fixed naturally. And I always thought in my mind, why is it that we're ostracized? Why is it that we were being picked on? Well, that's changed now, of course, which is great. Chiropractors and medical doctors work hand in hand, and everybody works together in harmony, and everybody's happy. And those days of being ostracized are gone. But I always thought the truth will prevail. And the truth did prevail. Chiropractic is an amazing form of healthcare. It gets to the cause of the problem, doesn't just treat the symptoms. And in most cases, it solves your problems. If it doesn't solve your problem, you could always go to step 2, which would be drugs. And then step 3, of course, would be surgery. Some people need surgery. Absolutely. But hopefully we can prevent it from happening. And that's why we work so closely with the medical community. We have orthopedists, neurologists, neurosurgeons, general practitioners refer to us all the time. And we refer back to them. And so it's kind of neat when the truth comes out. And it's kind of the same thing with elderberries. This is one of those, it's a home remedy. It doesn't have any validity behind it. Well, yes, it does. Also, what we want to do is make sure our immune system is working the best it possibly can. So a couple of things I want you to consider. Number one, I want you to consider your vitamin D levels. Vitamin D is a vitamin. It's really a hormone, not a vitamin, but there. And you need vitamin D to make your immune system work. Most of us are vitamin D deficient. And if you get your blood work done, you want to check your vitamin D levels, and chances are you're going to find that you're low. Most people are. And what can you do to get the vitamin D levels up? Well, you take a vitamin D supplement or get out in the sun. Now, this is where I disagree with some of my medical colleagues, is many times they'll write a prescription for vitamin D. But the prescription is vitamin D2. It's not vitamin D3. And your body needs vitamin D3, so it has to convert the vitamin D2 into D3. And that's a whole process that there's no need for because you could simply take vitamin D3. They also recommend about 50,000 international units of vitamin D2 once a week. I disagree with that because your body can only absorb so much of anything. Doesn't matter what it is. So if we're giving you 50,000 units of whatever, you may not be able to absorb a lot of it, and then it just passes out and it's wasted. I'd recommend you take about 5,000 international units of vitamin D3 as a supplement every single day. Now, in the summer, if you're out in the sun, you know you're going to be out in the sun for about 15 or 20 minutes a day, exposing a good amount of your chest, your arms, your legs, your face. You don't need to take a supplement because about 20 minutes in the sun is going to give you 20,000 international units of vitamin D3. A real easy, absorbable form. One of the concerns I find when it comes to the immune system is your body uses the sunlight to convert cholesterol into vitamin D3. So if people are on anti-cholesterol drugs, you may have too low cholesterol. I know you never heard somebody ever say that before, right? And if the cholesterol is too low, that can be a problem. So you want to make sure your cholesterol levels are normal and not too low. You want to make sure you're getting sunlight because that converts the cholesterol into the D3, and get your blood checked. And if you're low, you take a supplement. Now, we have something called Dr. Joe's vitamin D3, and it comes from lanolin, which is sheep wool. Now, the other form, the more expensive form, would be coming from an algae, but I also want to make sure it's affordable for people. Because with all my supplements, we try to keep the prices as low as possible. Many cases, or most cases, lowest on the market, and the quality high. And we can do that because we don't have middlemen. We don't have to go to a store. We don't have to have a sales rep. You just come right to us. So that's why we can keep the prices low and keep the quality extremely high, because it's the same products I take, by the way. We also add vitamin K2 to our vitamin D3 because K2 helps build strong bones. And if you have osteoporosis and you're sucking down calcium like it's candy, well, that's not going to build your bones. Never has, never will. You need vitamin K2. You need vitamin D3, by the way, to build bones. You need boron, silica, magnesium. So you need all these other components, but the two that most people are lacking are vitamin D3 and vitamin K2. That's why we put them in one dropper. So about 5 drops. 1 drop is about 1,000 international units, and you probably want to take that every single day to keep the immune system strong and help your bones. So there's no real downside to taking it. That's the nice part. And then again, if you get a lot of sun, then you probably don't need to take it then. We also have something called Dr. Joe's Wellness Booster. And Wellness Booster is Pau d'Arco olive leaf extract, suma root. And these herbs have been known to help stimulate your immune system generically. It's kind of across the board. So as opposed to your body attacking just a thing, it stimulates the overall immune system. Now in the winter, I take that every single day. Sometimes, in the summer I don't take it, but I take it every single day. And if I do feel a little scratchiness or cold or whatever, we have something called Dr. Joe's seasonal tonic. And that's ginger, horseradish, cayenne pepper, onion, garlic. Tastes the way it sounds, really strong, but it really is pretty cool because it helps wipe out the infections. So that's what I do when I'm feeling sick. Probably you should too. And those are all on my website, by the way. D3 to Wellness Booster to Seasonal Tonic. That's all on the website, drjoeesposito.com, or just Google Dr. Joe. Number 1 Dr. Joe in the world, thanks to you. Constipation, not something we talk about quite often. Not first date conversation, right? Hi, I'm Joe. Nice to meet you. A little clogged up today. It's not something we talk about, but it's something that needs to be talked about. Because you're supposed to take in nutrients, absorb the nutrients, and pass out the waste products. That's perfect. Well, unfortunately, in our society today, we're under stress, we're sitting a lot, we're dehydrated, you need water to make the bowels move, you're not eating nearly enough fiber, unless you're eating a totally plant-based diet, which I think you should, by the way. As you've heard my show before, you know how I feel about plant-based diets. So constipation becomes a big issue. Your bowels should move minimum once a day, and that's not even enough. Twice a day is ideal. So if you're not doing that, and I said once a day, not once a week or once a month, which most people consider normal. It's not normal. It's average, but it's not normal. You got to get the bowels moving. So a couple of things I want you to consider. Number 1, there's a valve in your small intestine, between your large and small intestine, called the ileocecal valve. And if you go from your belly button to your right hip, it's right. If you drew a line between your belly button and your right hip, it's right in the middle there. And if you want to feel it, it's kind of cool. You could lay on your back, and just push in that area and push around, and you'll feel something that feels about the size, maybe a $50, and it's kind of like a little bump, maybe like a scallop if I had to give it, or a mushroom if I had to give you a texture to it. And that's your ileocecal valve. And that valve opens and allows food to pass from your small intestine into your large intestine. Then the valve closes, water is absorbed from your large intestine, and then everything moves along and passes out in a perfect world. Some people, a valve is stuck open. You get diarrhea. Some people, a valve is stuck closed. You get constipation. So a little trick you can do if you have constipation, and you need to eat fiber and you need to make sure that you drink enough water, I'm going to cover some more things in a minute, is just lay on your back, get into that area where you feel it. It feels like a mushroom, like I said, or a scallop, and rub in a clockwise motion, pretty deep. And rub in a clockwise motion, and many times that can activate the ileocecal valve and get it working again. So that's kind of cool. Another thing we have to check are the nerves in the low back. The nerves in the low back control your back, hips, legs, knees, and ankles. So you might have back pain, leg pain, hip pain. But that same nerve controls your colon, sex organs, and bladder. So now you might see gas, bloating, diarrhea, constipation, urinary problems, sexual problems, all comes from that area of the body. So pinched nerves in the low back can cause constipation and romantic problems for men and women, and urinary issues, leakage, trouble holding your urine. So these are all things you want to consider. As always, whenever it comes to a health problem, check the nerve to the organ. So I want to get the nerves checked. I want to check the ileocecal valve if we need to. You're probably not eating enough fiber, so I want you to eat a lot more fiber. Day in my life? Thanks for asking. Start out my day with Dr. Joe's Super Greens and Dr. Joe's Essential Source. Every day starts with that. That's my drug, if you have to call it something. That's my coffee. How about that? We'll call it that. It's my coffee. Because when you start taking Super Greens and Essential Source, you just get your energy flowing, and man, you feel great. It's the minimum amount of nutrients you should be taking every single day. So if you're not taking Super Greens and Essential Source, minimum, you probably need to do that. And that's on my website, drjoeesposito.com, under store. It's also on Amazon. If you have an Amazon account, you can get it there. So Super Greens Essential Source, and then I'll have usually a piece of fruit, maybe a grapefruit. I think this morning I had a grapefruit. Did have a little bit of oatmeal because I was still kind of hungry. I waited about an hour. I do that first, and then I get my day ready, and I was still a little hungry. So I had a little bit of rolled oats, a very small amount. Okay, maybe enough to fit in the palm of your hand. I added a couple of raisins to it, organic raisins, and a little bit of almond milk, and I had that. That held me over till lunch. Lunch is almost always a salad. Salads are so cheap, folks. It's ridiculous. You can go to stores like even Aldi, if you have Aldi near you. I know this show goes around the world. But big box stores, you can get a big, what's called a clamshell, a plastic container of organic greens for like $4. And you could easily get 4 salads out of that. So it's $1 a salad, okay? Maybe throw in a cucumber, get crazy, woo! Throw in a tomato. Salad dressings, if you don't know what to eat. My first book called Prescription for Extreme Health. No, Eating Right for the Health of It was my first book. I'm sorry. In Eating Right for the Health of It, we tell you how to change your diet. Because people say, I don't know what to do, Dr. Joe. I don't know what to eat. I wrote a book for you. Eating Right for the Health of It. We have a whole chapter on nothing but salad dressings. But what I like to do is get apple cider vinegar, because apple cider vinegar is just awesome for your immune system, for your digestive system. It gives you minerals. It gives you magnesium to relax your muscles. But I don't like the flavor of it. It's too strong. So I use it as part of a salad dressing, and it works fine. So I'll do that, but we have a whole chapter on salad dressings in there. At least get some organic salad dressings, organic plant-based, no animal products like cheese or bacon or anything like that. And I'll usually put some nutritional yeast on my salad. Nutritional yeast is loaded with B vitamins. It's loaded with amino acids. It tastes great. It tastes real savory. Kind of like cheddar cheese, if I had to give you a flavor. Not exactly, but in that arena. And so that's lunch. And then sometimes I'll have maybe some vegan hamburgers or chicken. They have vegan chicken patties now made from mushrooms, actually. So there's several things I may have there. Or maybe just a couple of handfuls of nuts again. Or maybe some lentils or some split peas. And then dinner is more flexible. But did you see a pattern so far? Everything I eat is fiber-based. So that's going to help tremendously because in your colon, you have nerves called stretch receptors. And as you eat fiber and water, it swells up in your colon. The stretch receptors get stretched and stretched and stretched to the point where they fire off. And when they fire off, they cause the colon to contract. And that makes you go to the bathroom. So you got to get the nerve supply going to the bowels, and you have to make sure the stretch receptors are being activated by filling up the bowels with fiber and water, and then everything works normally. If you still can't get things working, we have something called Dr. Joe's Intestinal Cleanser. Now, Dr. Joe's Intestinal Cleanser's herbal formula, very easy on the bowels. It's not going to cause any urgency. It's not going to cause emergencies. It gently gets the bowels moving. And I tell you, the people that need it, they just swear by these things. I say take one, see how you do the next day. If your bowels are moving 1, 2, 3 times a day, you're good. If not, take 2 the next day. If still not, take 3 the next day. I'm going to tell you this, don't take more than 3. I had one lady take 6 one time. I told her, I said, don't do it. And she said, well, if 1 was good, 6 was better. And she came in that following week and she said, boy, those things really work. I said, yeah, I told you they work. So she was happy that it worked, but she took too many and it was her fault. And she knew it was her fault. So we want to get the bowels moving normally so that everything works. Now, folks, if you want to make an appointment to come see us, we have offices in Marietta, Duluth, and Stockbridge in the Atlanta area, because I know this show goes around the country. You can go to our website, drjoeesposito.com, or just Google Dr. Joe, and make an appointment to come see us. We have patients from all over the world come to us on a regular basis. And, of course, locally is a lot easier if you live in the Atlanta area. And we'll check your nervous system, make sure you don't have pinched nerves. We'll check your digestive system to see if your stomach is spasmed, if you have acid reflux, heartburn, constipation, diarrhea. And then we'll do a nutritional workup with you as well. But at least get the Super Greens, the Essential Source minimum, and then the other products that we'll talk about. Now, if you've ever been in a car accident, if the car was damaged, you were damaged 100% of the time. So every day, patients come in our offices and say, Dr. Joe, I heard you say on your show, if a car was damaged, you were damaged. And boy, were you ever right. Because at first I didn't think the pain was there. And I told the ambulance, don't even take me to the hospital. Now, some people do go to hospital, which is good too. And boy, the next day I couldn't move, or 5 days later, 10 days later, you have up to 6 months before the pain shows up. We're not here to treat your pain. We're here to treat the cause of your pain. So remember that. There's a difference. So if you were in a car accident, if the car was damaged, you need to come see us right away. The sooner the better. Even if it was 50 years ago, the sooner the better. So the website, again, to make an appointment, drjoeesposito.com, or just Google Dr. Joe, number one Dr. Joe in the world. Or the number is 844-44-DR-JOE if you want to call us, 844-44-DR-JOE. So we're talking about home remedies, things that you can do at home to help get yourself better. Now, probably once a week, maybe once every 2 weeks, somebody comes in with a chronic cough. And I say, Dr. Joe, I don't know what to do. I got this chronic cough. I've tried all the cough syrups. I went to the doctor. I looked at my throat. Everything's fine. But I have this chronic cough. Every time that's ever happened, in my 33 years of practice now, 34 years coming up, is the patient has acid reflux. The stomach is pushed up against the diaphragm, and acid is coming up into their throat. And when acid comes up into the throat, it irritates your vocal cords. And that can cause the chronic cough. Now, you can also have chronic sinus problems. If you have sinus problems, it could be the acid coming up into your sinuses. So the acid from your throat can come from your stomach can come all the way up into your sinuses. Ain't that wild? So if you have heartburn, acid reflux, burping, gas, bloating, chronic cough, sinus problems, it could be that your stomach is pushed up against your diaphragm. And when it is, the only thing that's going to fix that I know of is massage or pull the stomach down away from the diaphragm. Now, you can take medication for it, and that helps reduce your stomach acid, which can help the symptoms. But here's the rub. You need stomach acid to digest your proteins. And if you reduce your stomach acid, you're not able to digest your proteins properly, and that means you go into malnutrition. Not a good thing, is it? So, also the medications, a lot of them prevent you from absorbing calcium, B12, iron, and magnesium. Oh, well, that's kind of important, isn't it? Yeah, it is. So you want to make sure you get it fixed. And if you want to read an article on that, if you go to my website under Dr. Joe's blog or articles, you'll see an article about the 6th or 7th one down on GERD, gastroesophageal reflux disease. The gastroesophageal reflux disease is when the stomach is pushing up through that hole in your diaphragm. The heartburn or the acid reflux is what that causes, is the acid coming up into the throat. So fixing it is pretty cool. And in fact, over the years, when you fix patients, they're very happy. And they want to name their kids after my doctors for fixing their stomachs because it's so cool. Now, can we fix every stomach? No, we can't. But doesn't it make sense to try the most conservative approach first and then maybe more aggressive as we go down the line? To me, it makes perfect sense. I want to try the most non-aggressive technique first, and then go up maybe drugs and then surgery. So start out slow, build it up. That's what we like to do. I always say chiropractic first, drugs second, and surgery last. I'm not against drugs and surgery. If you need them, take them. But I'd rather fix it without. A lot cheaper too, by the way. If you want to save money, it's good. Diarrhea kind of follows along with constipation. It could be an ileocecal valve problem. It could be the bacteria in your colon have been destroyed. That's why so many people, when they take antibiotics, get diarrhea. Because when you eat food, you don't really digest the food. The bacteria in your colon digest the food, spit out what they don't want, and you absorb that. It's a simple way to put it. So if you've taken antibiotics, you could have killed off the good bacteria in your colon. So another home remedy trick is you want to make sure you're taking probiotics to recolonate your colon after taking antibiotics. Now think of the words. Anti means against. Biotic means life. It's against life. Probiotics in favor of life. So the probiotics are vital. And in fact, you have 10 times more bacteria cells in your body than you have human cells. You are not human, folks. You are life support for bacteria. That's all we are. And we want to make sure we feed the good ones. So probiotics are important. We have something called Dr. Joe's Probiotic Formula. It's on my website. And I take it quite often because I don't take antibiotics unless I have to. But we're getting antibiotics from so many other places. How about chlorinated water? Chlorine does what? Kills bacteria. Well, guess what? When you drink chlorinated water, when you shower in it, bathe in it, swim in it, you're killing off the bacteria in your colon. Not good. So we've got to build up that good bacteria in your colon by taking something like Dr. Joe's Probiotics. Now, in Dr. Joe's Essential Source, we also have prebiotics and probiotics. Whoa. What's a prebiotic? Prebiotics are food for the bacteria in your colon. They're carbohydrates like fructooligosaccharides. I just like saying fructooligosaccharides. They're good food. They're food that will feed the bacteria in your colon. You can't use the food, but the bacteria can, and then they can make baby bacterias, and that makes you happy. So same thing, you want to check the ileocecal valve like we talked about with constipation. That's the valve it's right between your belly button and your hip bone. You want to check the nerve supply, especially in the low back, that control the bowels. You want to make sure you have the right bacteria in your colon. And you could always do things like bananas and carob. You know what carob is? Carob is like a chocolate substitute. And if you take bananas and carob and kind of mash it together, that can help bind the stools in your intestine. Even bananas by themselves if you wanted to, but bananas and carob seem to work real well in chronic cases. But we've had chronic diarrhea patients forever coming into our offices, and when we work on the valve, the ileocecal valve, and then we work on the stomach, and then we work on the nerve supply, and get them on a good diet, and get them on high fiber, and bulk up their stools, and rebuild the bacteria, many times we solve that problem, which is pretty cool. Now, eye strain. A lot of us sit at a computer all day and our eyes get strained. You forget to blink, and sometimes at the end of the day, you're just kind of tired. So here's a cool little trick I want you to try. Take your hands and rub them together really fast for about 10 seconds. Remember Karate Kid, Mr. Miyagi? He slaps his hands together and he starts rubbing them together. When you do that, you create heat on your hands. Now take the heels of your hands where the heat is and just put them over your eyes. It's like putting a hot pack on your eyes. And just don't apply a lot of pressure. Just hold it in place for about 1 minute and then take deep breaths as you're holding it there. And what happens is the heat and the deep breathing stimulates what's called your parasympathetic nervous system, and it slows you down. If somebody's having a high blood pressure or rapid heart rate, you can put pressure on their eyes very gently, or you can put pressure on their carotid arteries, and that actually kicks in the parasympathetic nervous system, slows down the heart rate, lowers the blood pressure. So if you ever get scared and your heart's racing and you can't get it to stop, pressure on the carotid arteries, gentle pressure, or on the eyes, and it's a cool little trick. So again, we're talking today about home remedies, things that you can do to help get yourself well. Now, I'm going to have to go to break pretty soon. When I come back, we're going to talk about fatigue. How many people are tired? Raise your hands. How many people are too tired to raise your hands? Yeah, I know. We'll try to cover high blood pressure. We'll talk about some more digestive problems as well, because so many people have those. And then we'll talk about some pain management as well. Now, if you want to get my supplements, which, by the way, I think you should, Super Green's an essential source, absolute minimum. If you're under a lot of stress, if you're over 30, if you drink a lot of coffee, if you sit a lot, you probably want to take Dr. Joe's adrenal supplements. If you have circulatory issues, That could be brain function, cold hands, cold feet, also romantic problems for men and women. Trying to keep it clean. It's a family show. You got to get circulation to those parts. We have something called Dr. Joe's nitric oxide support. And it's made with citrulline. Citrulline converts into L-arginine. L-arginine converts into nitric oxide. Don't worry about the chemistry. And nitric oxide opens up your blood vessels. So those supplements, the immune booster, the wellness formula, those are all on the website. A bunch of other ones too. drjoeesposito.com, or just Google Dr. Joe. If you want to make an appointment to come see us, folks, stop suffering. Make the appointment. I know you've been meaning to. Go to the website, drjoeesposito.com, or just Google Dr. Joe, number one Dr. Joe in the world. Folks, I'm Dr. Joe Esposito. Once again, thanks so much for listening to the show. Tell your friends about it. We'll talk to you soon. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 p.m. Eastern Standard Time on WSBRadio.com and on the WSB Radio app.